let's talk about how to use sanitary pads and tampons safely and how to stay clean and healthy during your period. This is general guidance. If you have severe pain, very heavy bleeding, itching, fever, or unusual discharge or odor, talk to a trusted adult or a healthcare professional. First, start with clean hands. Before and after you change a pad or tampon, wash your hands with soap and water. Clean hands are one of the best ways to prevent irritation and infection. How to use a sanitary pad. Open the wrapper and unfold the pad. Most pads have an adhesive strip on the back. Peel off the paper and stick the pad onto the middle of your underwear, with the wider end toward the back for extra coverage. If the pad has wings, fold the wings around the underside of your underwear to help keep it in place. To change a pad, remove it from your underwear, roll it up in the wrapper or toilet paper, and throw it in the trash. Do not flush pads. Put on a fresh pad. A good routine is to change pads every 3 to 4 hours, or sooner if it feels wet, uncomfortable, or is close to full. Changing regularly helps prevent odor and skin irritation. Now, how to use a tampon. Choose the smallest absorbency that works for your flow. Start with clean hands. If you are using a tampon with an applicator, unwrap it and hold the applicator at the grip area. If it is without an applicator, you will insert it using your finger. Find a comfortable position, like sitting on the toilet with knees apart, standing with one foot on the edge of the tub, or squatting slightly. Gently separate the labia and place the tampon at the vaginal opening, aiming it slightly toward your lower back, not straight up. Insert the tampon until it feels comfortable. The string should stay outside your body. If you can feel the tampon after inserting, it may not be far enough in. You can wash your hands and gently push it a bit farther. A tampon should not hurt. If it hurts, remove it and try again with a smaller size or switch to pads and ask a healthcare professional for advice. To remove a tampon, wash your hands, relax your muscles, and gently pull the string downward and forward. Wrap the used tampon in toilet paper and throw it in the trash. Do not flush tampons unless the packaging clearly says it is flushable and your plumbing allows it. Tampon safety is important. Change tampons every 4 to 8 hours and never leave one in longer than 8 hours. Use a pad overnight if you might sleep longer than 8 hours. Using the lowest absorbency you need and changing on time helps reduce the rare but serious risk of toxic shock syndrome. Now, let's cover hygiene and staying healthy. Shower or bathe as usual. You can wash the vulva with warm water and a mild, fragrance-free soap if you want, but you do not need to wash inside the vagina. Avoid douching, scented sprays, and heavily scented wipes because they can cause irritation. Wear breathable underwear like cotton and change it daily. If you have a lot of sweat, discharge, or leakage, change underwear more often. If you can, carry a small period kit with pads or tampons, a spare pair of underwear, wipes or tissues, and a small bag for disposal. Stay comfortable and healthy by drinking water, eating regular meals, and getting enough sleep. Light movement like walking or stretching can help cramps for some people. If cramps are strong, a warm heating pad on your lower belly may help. Finally, know when to get help. See a healthcare professional if bleeding is so heavy you soak through a pad or tampon every hour for several hours. If you feel dizzy or faint, if you have severe pain, fever, or a sudden bad smell or unusual discharge. That's the basics. Clean hands, change regularly, use the right product for your flow, and keep your body comfortable and clean.